All right, welcome to another Wednesday. It's What's Up Wednesday with Disability Network of Mid-Michigan. Today we're going to spend a little bit of time talking about Part D. Part D is a Medicare prescription drug coverage plan. And so we're going to give a little bit of an overview of that. And then we've got an in-house expert that will have an opportunity to have answer some questions for us. So I'll get you started right away with just some general info. So as I mentioned, Part D is a Medicare plan that helps cover costs, and it's really like an insurance just for your prescription drug plans. We hear all kinds of questions about Medicare Part D, and that's part of why we wanted to have this conversation today. Many people want to know, well, are all of my prescriptions going to be covered by the plan that I choose? There are different kinds of plans, and we'll talk a little bit about that. So knowing if your pharmacy is in-network or out-of-network really impacts those costs and what's covered. We'll talk a little bit about something you might have heard of called the coverage gap and when that happens and what to do about it. There are some programs that can help pay for expenses, and we'll find out a little bit about eligibility for those programs. And some people have also heard about a penalty for what's called late enrollment. And knowing when you're eligible for Medicare Part D and what happens if you don't enroll or if you're really required to enroll is important. And that is also impacted sometimes by if you have other coverage or not. Sometimes, you may have a insurance plan and maybe your spouse has one as well. And so we'll talk about if those overlap or if you really need to enroll at a particular time. On the screen, there's a list of some common costs. There are things that, because it's an insurance program, you are required to pay for under Medicare. And one of those is the premium, just buying the insurance itself. Like many insurance plans, there is a yearly deductible. And so that means there's a certain amount that you have to pay before coverage kicks in. Just like many of our doctor's appointments or our prescription plans now, there are co-payments or co-insurance that might apply to a particular expense. There are costs when you're in the coverage gap, and I'm going to let Jamie tell you a little bit more about that when we pull her on the call. And then what happens if you get extra help? There is a program that really does provide extra help to help pay for those copays and premiums and even the drug coverage costs. So what do those look like? And then again, I mentioned that late enrollment fee, and we'll hear a little bit more about eligibility and when that applies. So the actual cost out of pocket for you is going to vary depending on what your prescriptions are, how many you have, and then what plan you choose. You can still choose your pharmacy. Some people decide to use a pharmacy that's in network. Typically the costs are lower if you have a pharmacy that's in network, but some people have a pharmacy of choice, somebody that they've worked with for a really long time, or maybe it's close to your home and you want to stick with that pharmacy and they're out of network. So that is a choice, but it does impact the costs that you're going to pay. Whether the prescriptions you use are on your plan's formulary is important. And I'll talk about the formulary in just a second. And then also whether you receive extra help. If you've got, if you are eligible for that program or one of those supplements, if you will, that can help pay for costs, then obviously your costs are going to go down a little bit. So every plan is required to have what's called a formulary. And they have a list of prescription drugs that they cover under that plan. Now, each plan gets to pick and choose what those are. And so that's why it's important that you not only have a plan, but that you make sure your prescriptions are on that list. They're broken into different tiers. There's usually, I think there's 3 tiers. Jamie can correct me on that. And for different types of prescriptions. And so you want to make sure that you check and make sure your prescription is on that plan. You can't just say, well, I've enrolled in a Part D plan and I'm covered, because those formularies are different. So you do need to make sure that you have a plan that's right for you. and that's based on primarily the prescriptions that you're taking. If your prescriptions are pretty steady, that's easier. Some of us have medications that change a little more often, and so that can get a little bit tricky. You also want to make sure that even if you have a really good plan right now, that when it's time for open enrollment, that you look at that formulary again, because drug plans can change their formularies from year to year. And they're not trying to trick you, they're trying to meet a greater need of coverage, but that doesn't necessarily mean, again, that it's right for you. So you want to check that every single year. There is a place on Medicare's website that you can compare plans. And sometimes that gets a little complicated too. So if you need help choosing a plan, or if you have questions about what plan is best for you, I just want you to rest with some confidence knowing that our staff are trained through the Medicare and Medicaid assistance program. So they've got the most up-to-date information. They know how to help you compare those plans and check those formularies, and can walk you through that whole application process. So if you want that kind of assistance, or if you have any additional questions, you can call us at Disability Network. Our phone number is 800-782-4160, or you can go to our website, and that's dnmm.org. Jamie is usually the first person that will take that phone call, and she's also our in-house expert regarding Medicare Part D. And so, Jamie, if you can pop up and join us, I do have a few questions that I think folks might have a lot of interest in. And the first just being, how does somebody know if they're even eligible, not only for Medicare, but Medicare Part D?
Generally, when they're going to be, the thing about Medicare is to watch the mail. If you are disabled before the age of 65, you will Medicare will automatically enroll you, or Social Security. You automatically get that stuff in the mail. The Medicare card will come in not an envelope that says Social Security. It's going to come in some off. So to watch the mail, and you're eligible on the 25th month after the date you became disabled for Medicare. So at that point, you're going to be getting A and B, and you'll want to sign up for Part D. If you're 65, probably 3 months before turning 65, you'll want to enroll for Medicare if you weren't disabled.
So it doesn't automatically enroll me in Part D? How do I know if I need that?
You'll want to watch your mail. You'll start receiving phone calls and just really close to that date, because if you miss it, there is a penalty for Part D. Actually, there's a penalty for them all, but Part D particularly, and B.
What if I don't have any prescriptions right now?
You still want to enroll in a Part D, because there will be a penalty no matter what. Even if you say, I don't have any prescriptions, because that's actually what kicks with a lot of people is, I don't take any medications. Why do I need to sign up for a Part D? It doesn't matter. You still need to sign up for one, because you will be penalized.
Okay. And one of the ways people have told me they remember that which part is the prescription drug coverage is that D, that Part D, D for drug. And so that's an easy way to remember that. Can you speak a little bit more about the late enrollment fee? Does it go up? Is it a one-time fee?
It's for the duration of that you're enrolled in Medicare. They do each year, they do a base beneficiary premium, and that's the base of the premiums cost a year. For 2020, that premium is $32.74. So then they take the number of months that you were eligible for Part D and didn't sign up for it, and it's 1% per month. So for example, if you went 24 months that you were eligible for Part D and didn't enroll, that's 0.24. And then they times that by the $32.74, which would end up with a $7.86 they would add that you penalized and have to pay for the rest of your time on Medicare.
So it can really
add up. It doesn't go away.
Yeah.
It's for good. Yes.
Okay.
It doesn't seem like much, but like I said, for the duration that you're on Medicare, it could add up.
So I mentioned the extra help program. Are there other things that can help pay for some of those costs for folks?
There's manufacturer drug programs. If we find that you're over income for the extra help, we go to the manufacturer websites through needymeds.com, and we can hopefully find some of manufacturer coupons, discount cards, or some of the stuff the manufacturer will offer, particularly for insulin, which is another good one.
Okay. So what is the eligibility for extra help?
The income limits, or just there's different charts because there's partial, there's different percentages they can pay. We can go full extra help, they can go partial, and then it's a different amount that they pay for towards your prescription drugs. Obviously, if you were eligible for full under the income limit, you pay very little, if anything, for your prescriptions, and then they go partial, and it's all sorts of different income limits. And we can easily run those. It's a 15-minute application. It doesn't take, it's very, very easy to see if people are eligible.
Okay.
But knowing their income when they call or would like that would be great. So we can run that really quick.
And extra help, what covers those copays and premiums and drug costs?
Nope, just the drug costs.
Just the drug costs.
Okay. The
Okay.
Medicare Savings Program through DHS would be the help with premiums, with your Part B premium.
Okay, and we'll talk about that on another episode. So
It's a lot of information.
yeah, there is quite a bit out there, particularly when you're looking at some of those plans. And I know folks get confused. I get confused sometimes about whether it's a Part D or a Part C, an Advantage plan. Is it a HMO? And then they even have a Medigap plan. What's the difference?
The Advantage plans are Part C, and those encompass probably everything you would pay. You would no longer use the Medicare. It would cover all your parts, and it covers the A, B, and the D. And generally, those can be from a small premium to zero. Like I said, it's just a matter of getting in there and comparing all the plans, and more what your health is like too, is another consideration between whether to stay with original Medicare. The Medigap are offered by private insurance companies and a little more expensive, and they generally cover everything. Your co-pays, like I said, those are a little more expensive. And Blue Cross Blue Shield, for example, those are private insurance companies that we don't sign people up for.
Okay, and just so to remind folks that Medicare A and B, that's both your medical and your hospitalization, right?
Yes.
Okay. And then Medigap sounds like it's insurance for when you're in the coverage gap. Does it cover more than that?
No, well, like I said, there's Part D. Like I said, as far as those coverage, they could be more expensive. So like I said, I wouldn't advise them for everybody. They're more advised for people who maybe have a lot of health problems.
Okay, so what can you tell me about the coverage gap? Will everybody fall into it? When is it? What is it? How much is it? It sounds
it depends. It is. It's used to call the donut hole is actually the term for it. And Part D benefit, can I read this off to you in the charts? Your Part D benefit cost periods. The first one is you have initial deductible no matter what with Part D. Then you fall into your initial coverage period where the drugs are covered. And then you fall into the coverage gap or the donut hole, which the cost this year, the total amount for the initial deductible is $415 this year. Then they cover up to $3,820 in your coverage period. So depending on your medications, you may never hit it. Most people will never hit it, but this could fall into the more expensive drugs. Some types of insulin can be really expensive. Once you hit that limit, you hit the donut hole. And then that up to $3,833.75 is the total amount spent during the gap that you would occur. and then you would get the catastrophic benefit period. So there's 4 periods to Part D.
And does that happen every year?
That's every year.
That's every year.
Yeah. Period.
Okay.
It doesn't, once you hit it, you're not good for life type thing. It's every year the amounts change. The deductible, the initial deductible period will change every year. So it's a matter of just to check. But like I said, most people will never have to worry about the donut hole. But like I said, that it's still there hanging for some people, and to know the information ahead of time. And when you do the plan comparison, it will let you know what month you're going to hit that, when you're going to hit catastrophic, when if you're never going to hit it. It lays out in the 12-month period coverage of when you're going to hit, what your costs are going to be per month. So people will know ahead of time.
Which again is why it's also really important. So if I'm picking a plan, that I actually know what my medications are, because some plans might cover them and some might not.
Oh, definitely. They change every year. Your Medicare, the plan you picked the year before may decide next year they don't even want to cover that drug anymore. So if you don't check the plan, and they do send out every year, the plans are required to send out changes they're going to make, or just to send out something ahead of time before enrollment period.
Okay.
But if you don't pay attention to the mail, a lot of people do miss that stuff, or might be, it's confusing, you know, of why they're doing it this month. Well, they did it for me last year, or just not pay attention. So it's best to check, because once that enrollment period rolls by and ends on December 7th, you can't change. Once it kicks in January 1st, you are stuck with it the rest of the year, generally for most people. So if it doesn't cover your drug, you know, saying I didn't read my mail, I didn't know, isn't going to do much, unfortunately.
Now, if I'm on Medicaid and Medicare, does that make a difference about if I can change plans? I know it used to.
Once a quarter, if you're eligible for special help, you can change once a quarter that following year. But like I said, that's for eligible for that low income subsidy we were talking about earlier.
But if I do a good job picking a plan, and I mean, unless I have a big change in health conditions, I probably wouldn't want to change it anyway if I picked a good one to start with, right?
Right,
Yep.
right.
Okay. Let's see, I mentioned the plan compare on the website. Is that user friendly? I haven't been on it in a really long time. If people want to go and try to compare plans on their own.
It has you create, I believe it started last year, it has you create an account. You can go in and compare without it, but the nice thing about the account is it saves you information. If you have a lot of prescriptions, it saves the plan you enrolled in last year. You can always go back in and look. So it might throw people off or be overwhelming to say, oh, I got to create an account. You can go in and compare without it, but it's not going to be very accurate. In a sense, and be able to compare your last year's plan, this plan, and then having to punch in your prescriptions every time, it would be a little annoying as well.
So it's worth it.
Yeah, it's fairly user friendly.
Okay.
Yes.
What are the tiers, and why are there tiers? Do I need to worry about that?
Yes. The tiers generally run generic. It's preferred generic, and then brand name. Generally, if you're taking a brand name prescription and it's outrageous, or won't be covered if your doctor, you can go to your doctor. It's good to know where your prescriptions fall, because it can make a big difference in the plan. If there's something generic that you could take and it's significantly cheaper that your doctor, you can check with your doctor or the pharmacy, it can make a huge cost difference. Okay. And that's just the way insurance companies do it. You know, if they're going to give you, if there's a generic out there and you're on a brand name, it's just lower costs, the insurance company, honestly. But everybody insurance company does a tier.
So what if my,
I think there's 3 or 4.
Okay, 3 or 4 tiers?
Yeah.
Okay, so they're different cost ratios, it sounds like. So if my prescription does come in a generic, but for whatever reason my doctor says I need to take the brand name because of a sensitivity or it's more effective. I mean, we hear that a lot with like Synthroid and insulin and even seizure medications. Does that like give me a break? Does it make a difference if the doctor says it doesn't? Okay. So I would need to know that if I can take the generic.
Yeah.
Okay.
Try to find maybe a cheaper plan, or maybe that would be the best thing is to compare the plans.
Okay.
Because everyone does, and not every insurance formulary plan is the same cost. They each have a formulary, but hopefully another plan would be cheaper. But like I said, that doesn't change because you have to take a brand name. You got to pay that cost.
Okay. So is that something that I can do over the phone with you if I needed help enrolling?
Yes.
Okay.
Definitely.
All
Yeah.
right. Anything else
Just have
about?
to sign in, do some work. Like I said, the biggest thing is having people check every year. Some people think, oh, my plan's great. Your plan can drastically change. Always to watch the mail. Open all the mail comes in if you're eligible for Medicare, particularly because you don't want to miss anything, but to always check the plan. It may be really quick, it may not change, but I think it would give peace of mind to know and not have any surprises, I guess, come the middle of the year that you can't do anything about. Big surprises.
Most of us don't have
eventually.
extra money to throw around, so that's that's good to plan ahead.
Yeah, particularly for if it's a maintenance medication, particularly come and then you hit a donut hole, that you didn't know was coming and could have been prevented, I think would be the hardest pill to swallow, I guess.
Good one. All right, well, we appreciate your expertise. We'll make sure we send folks your direction if they have other questions about Medicare Part D and prescription drug coverage. So I appreciate your time.
Yeah, it's like you said, it's all new, it's all overwhelming, it's all over. I can imagine if it's overwhelming for me, it's overwhelming for everybody else too. So
yeah, it's good that you're there to help walk us through that. So I appreciate that. Thanks a ton, Jamie.
Yep.
That's all for this week in regard to Medicare Prescription Part D. Next week, we will talk some more Medicare. We'll see you then.